Hi, it's Patrick Hutzel from IntensiveCareHotline.com with another quick tip for families in intensive care. Yesterday I was talking to a client, Stephen, and Stephen's mum has been in intensive care now for 18 days after a cardiac arrest. Now the intensive care team wants to stop treatment or wants to look at another option, which is to do a tracheostomy. But they are more pushy towards end of life and stopping life support. Now my advice to Stephen is don't agree to stop life support, because that in essence means your mum is going to die, but rather opt for a tracheostomy. Stephen said that the ICU team has been very, very negative and has been painting the doom and gloom picture and has been very, very negative. So my question to Steve is, well, as long as your mum is alive, don't you think she can live? And that's the bottom line. You've got to look at actions and outcomes, not so much at what people are saying. The bottom line is your mum is alive, and yes, she may not have any good quality of life at the moment, but with head and brain injuries after cardiac arrest and a hypoxic brain injury, it needs time. Sometimes takes months to recover from that. So you got to look at what's possible and don't buy into the doom and gloom and the negativity. The intensive care team is just trying to manage their worst case scenario, which is basically to empty their ICU bed and create resources so they can admit more patients. So that's my tip for today. Look at what's happening. Don't pay too much attention to the negativity, and look at what's happening. If your loved one is alive, that's a good sign. So let's take it from there and let's push towards a meaningful recovery and not towards end of life. That's my tip for today, and I'll talk to you in a few days. This is Patrick Hutzel from IntensiveCareHotline.com.